Good morning, everyone. I'm Christine Dixon-Deasing, the Director of Academic Programs with the South Carolina Research Authority. I also have on the line with me Paul Dudley, Program Manager for SCRA. Paul, would you like to introduce yourself?
Yeah, absolutely, Christine. Thank you. Good morning, everybody. It's Paul Dudley. As Christine mentioned, I'm the Program Manager here in the Academic Programs section of SCRA's Academic Programs Office, and I'll be working with her and helping you as you navigate the process to submit your application. Look forward to it.
Thank you, Paul. I'm going to cover some of the basics for this webinar. I do want to warn you all, this is the first time we've used this system, so hopefully there are not any hitches along the way. But I did want to let you know that we are recording this session, including the question and answer and collaboration sessions portions at the end. We will be posting the recording on our website at this address shortly after the conclusion of the session so that you can share that with your colleagues as well. I also wanted to let you know that your audio is currently muted. We will unmute the audio when we get to the Q&A portion, and then we will also be tracking questions. If you could please kindly, when you look at your module for GoToMeet, the GoToWebinar module, there is a questions section. And if you could please enter your questions there, please do not enter them into the chat section, as we'll be tracking everything on the questions module instead. I'd like to provide you a brief background on SCRA and its academic programs group before we kick into a more in-depth discussion about the RFA for technology-enabled population health. And then, as I mentioned, we are going to certainly open the floor to questions. And then, since collaboration is such a key aspect of what we're doing under this RFA, we are also reserving time at the end to allow people who are on the line and looking for collaborators to promote what they're doing and perhaps make some connections. So with that, I'm going to just start with a brief synopsis of SCRA. We are the South Carolina Research Authority. We are a public nonprofit corporation that was established by an act of the South Carolina Legislature in 1983 with the mission of growing the innovation economy of South Carolina. We execute on that mission through 4 different operating divisions. The Industry Programs Group is out in the field speaking with companies that are based in the state of South Carolina, identifying what their needs are, and finding solutions elsewhere within the state ecosystem, sometimes through other companies in South Carolina, but also through academic research and entrepreneurial efforts. We also have an Entrepreneurial Programs Group, which some of you may be familiar with. It goes under the branded name of SC Launch. And this is a program that helps provide mentoring as well as grants and ultimately investments into South Carolina-based startup enterprises that are developing technologies. And then finally, I'm the Director of Academic Programs, and I'll be going into greater detail what we're doing in academic programs momentarily. Finally, we have the Facilities Division. SCRA operates 3 different innovation centers across the state that house a variety of wet labs and research facilities. So our facilities are available to not only startups, but also academic researchers that are looking to expand their research capabilities. With that, I should also mention that SCRA focuses its efforts in 3 industry verticals within the life sciences, information technology, and advanced manufacturing and materials. Before I take a deeper dive into the RFA that you all are interested in learning more about, I did want to make you aware that Academic Programs also has other funding opportunities that are available. The first one there listed is the SBIR STTR Matching Grant. This grant is available to any recipient of the federal Phase 1 program that is a South Carolina company with more than 50% of its payroll in South Carolina. While it falls under academic programs, it is not a requirement that the applicants or recipients be affiliated with an academic institution. The next 2 grants, however, do require academic affiliation. So the Academic Startup Assistance Program is seed funding that goes to startups that are advancing intellectual property out of any of the public or private academic institutions in South Carolina. And then finally, the Maturation Grants. This is a new program we piloted last year. Several of the academic institutions have maturation funds that they put as a form of investment in advancing technology that has come out of research at the institution. And our maturation matching grants are there to augment the impact that those funds can have and expand the research that can be conducted. But finally, the subject of our discussion today are the SACT grants. And I will go into greater detail about the SACT and its background momentarily, but I do want to let you know that these grants are typically $100,000 and they have a very specific research focus to them. When SCRA was formed back in 1983, the South Carolina legislature had great forethought in recognizing the impact that academic research has on the innovation economy of the state. And so with that, 5 of the 9 founding tenets for SCRA's mission focused on academic research. In the years that passed, it became clear that we needed to reconnect with our stakeholders to realign the services that we were providing within SCRA and ensure that they were addressing needs that our academic partners needed. So we started a task force to address that particular issue, which ultimately culminated in signing a collaboration agreement in December of 2016 that outlined 3 key areas where the academic institutions wanted additional support from SCRA. The first of those is growing our support for academic startups, and we do a lot of those efforts through the entrepreneurial programs and SC Launch initiative. However, as you can see, some of the grant funding that we have in academic programs is also focused on academic startups. Then we were also charged with investing in the research infrastructure within the state, so purchasing equipment as well as funding pilot projects. And I do want to mention that if SCRA purchases a piece of equipment for an academic researcher, that piece of equipment becomes available for any academic researcher across the state. So there is a management plan that's put in place to enable access to that infrastructure. Then finally, the component where we spend most of our time in academic programs is in growing our multi-institutional research efforts. So when I say multi-institutional, yes, that certainly checks the box of grant funding for multiple institutions within South Carolina, but also drawing industry into the conversation. How can we bring industry insight into the academic research process earlier on to validate markets and ensure maximum economic impact? So with that, when the collaboration agreement was signed, a committee was born to design and implement programs to deliver under that collaboration agreement. And that committee is called the SACT, which stands for the SCRA Academia Collaboration Team. I promise you that that's the only acronym I'll ask you to remember today, but it is an important one because this is a 9-member committee that has representatives from the research universities, the primarily undergraduate institutions, the technical college system, and industry, all together determining how we can move forward as a state to have a larger economic impact with our academic research. And so with that, last year was spent working through where there really is connectivity across the different academic institutions in the state that also has a wealth of industrial partners in South Carolina as well. And so with that, we ultimately determined 3 different fields of research where we were going to focus our efforts going forward. The most recently approved one is in Industry 4.0, which is the confluence of information technology and manufacturing. Another one is in the medical device space. We did submit a grant application to the Economic Development Administration back in August with 2 of the academic institutions in the state requesting funding to build out the entrepreneurial capacity in the medical device space in South Carolina. But then, of course, the focus of today's call is the Technology-Enabled Population Health Research Alliance. And so with each of these fields of research, once approved by the SACT, the next step is to build a feasibility assessment team. And these are teams of subject matter experts from across the academic institutions that are able to provide more insight into the expertise and infrastructure that's available across the state. And then we work through an entire work plan to assess the feasibility of that program in South Carolina and rising to the level of national renown. So with that, the SACT did determine that the most efficient way to move forward is building out research alliances. And so as we're working through the feasibility assessments for these different research fields, I do want you to gain an appreciation for the fundamentals that are required for a research alliance, and the criteria involved, because this all factors into how the grant applications under this RFA are reviewed. So for a research alliance to be deemed viable, we have to be certain that we have a critical mass of commercially relevant technologies, infrastructure, expertise, and intellectual property within the state, as well as potential industry partners in South Carolina. And then to evaluate each of the options for potential research alliances, we needed to be certain it was addressing industry needs, that we were creating workforce development opportunities, jobs, and startup formation. So those typical economic development pieces that are a bit foreign to academic research. But then we also wanted to be certain that we were tapping into capabilities across multiple institutions. We did not want this to be a research alliance that's strictly highlighting something that's going on in one of our institutions. And we're especially interested in building collaborations between the primarily undergraduate institutions, the tech system, and the research university. And then finally, of course, sustainability is a chronic issue for everyone. And so we want to be certain that we are going to be able to identify external funding, be it federal or corporate funding, to make these research alliances viable long term. So I'd like to speak for a moment about the Technology-Enabled Population Health Alliance. I do need to give you some context here. It is a bit unusual that we're so specific with regards to the deployment of technology. That is because we are acutely aware that there are many people and many organizations across the state that are already charged with addressing the population health issues that are seen here in South Carolina. Being SCRA and the Research Authority, we're interested in promoting solutions that are technology-based, scalable, and economically feasible to have that impact on some of the health equity issues that we see in South Carolina. And so with that, the Research Alliance is focused on developing and deploying new technology-based solutions for population health issues. And again, that comes back to addressing health outcomes and disparities that we see both geographically and socioeconomically across the state. We also recognized as we went through the feasibility assessment process that South Carolina has a wealth of patient health data through HSSC and other databases available across the state. And those resources are not necessarily utilized optimally. And so we are interested in actively encouraging applicants under this RFA to use those resources and evaluate the data sets that are available there, as well as finding ways to develop IT solutions based on that information. And then finally, of course, workforce development is a key aspect of what we're doing at SCRA across the board as well. Now, there are some key aspects that are required for participation. Again, as I said, we cannot focus on a single institution. We are here to build collaborations, and not only collaborations between the academic institutions, but between academia and industry as well. Now, industry in light of population health is a bit different. Obviously, there's not people out there creating widgets for population health. So instead, we look at industry really being those who are bearing the cost of the healthcare burden in the state. So CMS, as well as the private payers and managed care operations. We also want to be certain that there are going to be near-term measurable outcomes for the research that goes on through this research alliance. I understand that's a big ask in population health. A lot of times you may not have measurable outcomes for years, but with this, we're asking applicants to think through what types of discrete milestones they can identify with the research that they're doing. And then we're also, of course, keenly interested in ensuring that there's going to be a translation component. So getting this research out of the academic environment and into the hands of industry, again, in this case, industry being either those who are paying for the healthcare system or service providers. And then finally, we want to address the health issues that we have within South Carolina. Many of you are acutely aware of the challenges that we face in this state. There are a few aspects I need to be clear. We are not going to be funding under this RFA or under the Research Alliance in general. We recognize there are many people out there already delivering healthcare services to address population health issues. That is not our field. That's not where we operate. So if you're looking for a service-based model, we are not the correct partner to work with on that. And of course, as I mentioned before, we recognize there are many others working in the population health space in South Carolina. We have done an exhaustive benchmarking of those systems and want to ensure that we're not duplicating any of those efforts, which is why we have this very specific technology focus in everything that we're doing in population health. Ultimately, we do hope to expand the reach of this research alliance beyond issuing RFAs periodically. And so we want to, after speaking with the subject matter experts who conducted the feasibility assessment, they really were looking for opportunities for matchmaking and building interdisciplinary teams. For example, connecting computer science and analytics to those providing care in the field. So with that, we do accomplish some of that through this RFA, but we would like to do so in a more coherent fashion as well going forward by potentially having symposia along the lines of population health. There was also interest in providing policy advice and advocacy, but I will tell you that actually has taken a back burner right now because we want to focus on the research side of the equation. And then finally, when we did the benchmarking, we wanted to be certain that the work we were doing was differentiated. And so with that, we identified that although there are a lot of research going on across the country with regards to population health, there are not many that point to interconnectivity between industry and academia, and also the statewide breadth of what we're doing and the interest that we have from across the state and across the different types of academic institutions is certainly unique. And so with that, as you have seen in the RFA, the scope here is technology focused, either developing new technologies or deploying existing technologies, preferably South Carolina-based technologies if it's deployment of an existing technology, that are going to address population health issues. We're also, of course, looking to improve health equity issues that are seen across the state. I understand measurable health outcome changes are not something you're going to see in the one-year performance period, but nonetheless, again, as I mentioned, we are asking for you all to try and identify discrete milestones along the way. Then we're also looking to utilize our data sources that we have across the state. If any of you are interested in tapping into those resources but are not familiar with them or don't have a point of entry, please do contact us separately and we will make those connections for you. And then finally, of course, training the next generation of care providers. And this is not just physicians and nurses, but also techs and advanced care professionals. And so with that, I just want to summarize that with the awards, we're going to be looking to give 3 awards of up to $100,000 each. And we'll go through those details in separate slide momentarily. With regards to eligibility, please do pay close attention to this. This is an area where we had a lot of confusion with the previous RFA. Because this funding is under academic programs, the money must be going to academic researchers. So the applications have to be coming from what we call constituent institutions. If you look at the bottom of the slide there, you can see the definition of constituent institutions. It's the degree conferring public institutions of post-secondary education in South Carolina. And again, this covers the entire gamut from research universities, tech colleges, as well as the PUIs. Also, keep in mind, this is mandatory for this RFA. You must have collaboration. So that collaboration must either be between at least 2 constituent institutions or between 1 constituent institution and 1 industry partner. The industry partner, I should also be clear on this point, while I keep referring to industry as the payers, also other companies that are in South Carolina developing technology to address population health issues do qualify as industry partners. And then finally, this is a new component. Now, since this is the second RFA in this space, we wanted to be clear that if you currently are in the performance period for the SACT feasibility grant in population health, you're not eligible to submit under this RFA. So even if you were a co-applicant, you are not eligible to submit. But I want to emphasize that is at the investigator level, not at the institutional level. So someone else in your institution is certainly welcome and able to submit. I'm going to run through the review criteria quickly here. Looking at the technical criteria, I'm sure most of you are quite familiar with the NIH criteria for technical review. With that, looking at significance, the investigator's innovation and approach. We do go into greater detail using the NIH language in the RFA to clarify what the objectives are for each of those criteria. But then the other component that we add in is follow-on funding. And you're actually going to see follow-on funding showing up under the technical criteria as well as the strategic criteria. And so with that, I just really want you to appreciate the importance of that component in the grant application that speaks to follow-on funding. Again, sustainability is paramount. We want to know that this funding is going towards something that can then attract additional funding to continue the research. I am going to pause here to explain for a moment that the technical review criteria is all done by external technical reviewers. So that is not done within SCRA. It is not done within the SACT. We identify experts in the population health field to review the applications. The reviews from both the technical side and the strategic side are provided back to applicants. The technical review is going to be conducted in January, and Paul will speak to this later as we go through the timeline. But then the information from the technical review and all of the feedback gets sent back to the SACT for their consideration as they then perform the strategic review. So this is what you see in the right-hand column. And this is the criteria that's probably a bit different from what most of you are used to seeing. This strategic criteria is there to really align with the Research Alliance criteria that you had seen on the previous slide. And our objective to build collaborations across institutions, as well as building bridges between public and private with regards to industry engagement. And so with that, I'm going to walk through these different strategic review criteria into greater detail, but I want to be clear they're also elaborated on within the RFA. So we are looking specifically for impact on the innovation economy, and this is weighted twice all of the other criteria. So I really want you to appreciate the impact and importance of this. We're looking for long-term potential for job creation, startup formation, generation of intellectual property, opportunities for workforce development, as well as how broad of an impact can be had on the state of South Carolina. And then we also have additional weighting for involving a primarily undergraduate institution or a technical college. So this weighting goes from 5 points to 3 to 1 point. If there are multiple primarily undergraduate institutions or technical colleges, that application receives a score of 5. If there's only one, it receives a score of 3. If there are none, it receives a score of 1. Likewise, on the creation of new academic and industry collaborations, if there are multiple new collaborations with industry, that counts as 5. If there's only one new relationship built between academia and industry, that counts as 3. And then if there are no industry partners or collaborations under the application, it will be scored a 1 on that component. And then we move on to translational significance. This is really market potential. And has the market been validated? Is it a new space? And what size is it? How large of an impact can it have financially? And then we come back again to follow on funding. So while the SACT will have input from the technical reviewers with regards to opportunities for follow-on funding, at SCRA and through the SACT, we will also be assessing that as well. So truly that does have, while it's scored as a 5, we're getting input from the technical reviewers on that front as well. And then finally, then looking for matching funds. So with this, I do want to emphasize, although it's listed here as matching funds from the applicant institution, this could also be matching funds from your collaborators, their collaborating institutions, and also with your industry partners. And when I say matching funds, it does not have to be dollars, and kind contributions also count as well. Then the final strategic review criteria is making certain that there are objectively measured milestones. I've said that multiple times, and it is important because we need to be able to monitor success throughout the performance period as well as at the end. And so with that, I'm going to turn it over to Paul Dudley.
Thanks, Christine. And our intent for showing you the overall timeline for the RFA is to give you a sense of the various milestones associated with the various parts or aspects of it that need to be completed to make the final awards in May. Obviously, we were able to release the RFA last week, and you are now at the October 31 milestone of the information session. The applications themselves are due December 17th as specified in the RFA. That's going to be at 5 p.m. Eastern Standard Time. And then from the period of December 18th through the 21st, we will be conducting a pre-review, as Christine mentioned previously, where we ensure that all the applications that we receive are strategically aligned with SACT's intentions and compliant with the RFA. This is one of the areas where I would like to draw your attention to some of the specifics within the RFA, where it does talk about how you structure your application and the way you label it. So please do follow the application content labeling criteria and follow the exact template that's laid out for us in the RFA. That'll help you ensure that you make it through the pre-review process successfully. If you label it and follow all the instructions in the RFA on page 5, you'll be fine in this regard. As Christine mentioned, throughout the end of December and early January, we'll be sending out all of the applications that have completed and passed the pre-review to our technical external reviewers, who will exhaustively review all of your applications on the technical criteria that she outlined on the previous slide. At the end of that period, we will actually convene the reviewers and conduct a study section with them and go over all of their results from what they have found, and then synopsize those and provide those to the SACT in a report for their review at the end of January. Then at the February meeting with the SACT, we will sit down with them and actually conduct an in-person study section in which they utilize the technical report from the external reviewers as well as their own assessment of the strategic criteria, and then make the ultimate decision on which of the applications to fund. We then notify you at that point shortly thereafter whether or not you're going to receive funding or not, and then we begin building the actual contracts, and our goal, as mentioned here, is to have them finalized by May 10th of 2019. This is a reiteration of the submission process that's already in the RFA itself, but just as a reminder, there are 3 attached documents that are fillable PDFs that are in Appendix B of the RFA. They are the cover page, the budget form, and a form that addresses your current and pending support that you're already receiving. Please combine all of those along with your actual application into a single PDF file and submit per the instructions in the RFA to academicprograms@scra.org. On the cover page itself, please ensure that it is signed by the authorized organizational representative from your institution. In previous rounds of the RFA release, we've had individual investigators sign those and others who are not the actual authorized organizational representative. So do please take care to ensure that is signed and filled out properly. That just gives us insight that the institution is aware of the work that you're doing and that you have submitted the grant on behalf of their school. Again, I have already hit on the importance of following the formatting instructions within the RFA. That is critical. It makes it easier for us to review, but it also ensures that you're covering all the things that we're going to be assessing you on. So we do provide you with that template and format for your benefit. As a reminder, they are due at 5 p.m. on December 17th. That is Eastern Standard Time. And as I detailed in the outline of the schedule on the previous slide, the SACT will make their funding decision by the end of February 2019. The contract's in place by May of 2019. This page is to give you a sense of where you can find various items associated with the RFA. Obviously, I think you probably have all found our landing page by now, but there you'll find the RFA, the cover sheets that we just mentioned. There'll also be a frequently asked questions that includes questions and answers from our previous question and answer session last February for the first iteration of the Population Health RFA, along with any questions and answers that you submit to us today and that we also answer. Additionally, you'll find a link for the recording of this session and the physical slide deck that's been presented. Additionally, we're also including the EPSCoR IDEA Research Expertise Profile because this is something that SCRA and SC EPSCoR have put together that will allow you to identify potential collaborators in the field of population health. If you visit this site and then enter into your parameters into it, it will help identify other researchers and potential industry partners that you could potentially collaborate with on your application. As always, as Christine mentioned, if you do have any questions regarding your application, please feel free to contact me at any time. That's why I'm here, is to support your efforts in submitting your application. So don't hesitate to send me an email. By all means, that's why I'm here to help. Again, I won't go over the application submission time again. I think I've hammered that home sufficiently. And at this point, what we'd like to do is open up the conversation to questions and answers, and then at some point transition into a collaborative discussion where we allow you to potentially make relationships and introductions to others on the call who might be interested in working together.
Thank you very much, Paul. We do have one question that's been submitted, so I do encourage you, if you have other questions, to please submit them through the question module on the GoToWebinar interface. The first question that we have is, do collaborations need to be with South Carolina-based institutions and corporations exclusively? And the answer to that is yes. Not only that, but the academic collaborations need to be with constituent institutions, which are those public institutions of higher ed in South Carolina. But then, yes, on the industry side as well, we're looking for engagement with South Carolina-based enterprises. With that, I'm going to unmute the attendees so that you all, if you have other questions, would like to ask. It is not letting me unmute you all. To give me a moment here. Pardon me, y'all. A moment. Pardon me, y'all. We have not been able to unmute the attendees. If you all would please so kindly enter your questions through the question box while we work this out. I see that we do have another question here. Would the VA be considered an industry provider? Yes, in this particular context, I do see the VA as being eligible to serve in that role. And then another, how do you become listed in the expertise profile? So if you follow the link on the page here under the second bullet, you can go in there and you can register in there. Now, I would caution that that may be exclusively for academic researchers. I apologize, I don't know off the top of my head if companies are eligible to create a profile in there. Everything I've seen so far has been academic researchers. And with that, if you all will please hold the line for a moment, I do need to resolve this technical issue so that you all can participate in a conversation for those of you that are looking for collaboration. All right, everyone, I believe that I've been able to activate the audio for most of you. If you could please confirm. Some of you appear to not be connected via the call-in number, and that's why some of you are not appearing as able to speak. I do sincerely apologize. As I mentioned, this is our first time using this system, but I believe from what I can see, everyone who is on the line now is able to speak. So with that, I would like to open the floor to those of you who are interested in talking about your expertise and your project, if any of you are interested in looking for collaborators. All right, it sounds like there's not a need on that front, but I do see that I have a question, so give me a moment and I will review those. There was a question of if the public libraries would be counted as a constituent institution. No, they will not. So a constituent institution is exclusively the academic institutions that are public institutions in South Carolina that are degree conferring institutions. Another question, will there be a place to post a search for a collaborator for a given subject matter? I encourage you actually to speak right now. Are you able to do so and share what you all are looking for a collaborator on?
Can you hear me?
Yes.
Okay, we're a technology provider in the augmented reality and vision space smart glass technologies, and wanted to know if there was a place that we could post that we have that technology, those technologies available if someone is looking for such collaboration.
My first suggestion would be right here and now to go ahead and talk about your technology, and then also go to that SC EPSCoR website and post your information there as well. So would you be able to elaborate on the technologies you have?
Yes, certainly. We have technologies to capture persons performing tasks and then put them into a reality or an augmented reality platform where they can then be viewed on various platforms, mobile devices, heads-up display, smart glasses from various vendors. So if someone is looking for a research partner that has those capabilities in place for collaboration, we'd certainly be interested in that.
Excellent. Does anyone else on the line have any questions for Philip? All right, then, Philip, I would recommend. Oh, yes?
Very quick.
I'm sorry. I'm having difficulty hearing you. Are you asking a question?
This one was only 40.
Okay, I think that's someone who's just not muted and is not asking a question. So, Philip, I do encourage you to go to that EPSCoR website. And in there, you may also be able to find people in the academic realm who are working in that space.
Okay, thank you.
Mm-hmm. And that looks like that's the end of the questions as well. We also on our website have the frequently asked questions there. We'll update them with the questions that we received today. And of course, you're certainly welcome to submit a question to Paul or I as well. So with that, I just wanted to open the floor one more time to see if there were any additional questions. All right. Well, thank you all so very much for joining us today. And we look forward to hearing from you in the future.
Thank you.
Take care. Bye-bye.